Hi, in this video, I'm going to be talking about what you do when you're getting chemotherapy or other IV treatment and you're bored. Now, the first time you go, there's a lot more interest, right? You're not in a routine, everything's new, you're being oriented to what's going on, the medications that you're being given, you're getting to know the staff, and sort of getting acclimated. So there's not a lot of boredom the first treatment. Everybody's explaining to you what's going on. And for some medications, you can even have a reaction with the first treatment. And so you might be a little bit on edge. But after treatment, after treatment, after treatment, you can find yourself getting really bored. Now, some of my patients bring somebody with them. The person who drives them comes and sits with them, and that can really help pass the time. But I have a lot of patients who would prefer not to have somebody in the infusion center with them. They're just more private, or somebody drops them off and another person picks them up. So what can you do when you're passing that time? Well, I have a couple tips for you. The first would be to read a book. If you're not much of a reader, this might be a time that you want to get back into reading. If you're not used to a big, long, thick book, you can read short stories, or you can read a play. You can read something a little bit different. Of course, we're all used to reading on our phones now. So of course, you can bring your phone and read Twitter if you want to. You can read books on your phone. You can read the news. You can also write in your journal. I have a lot of patients who get a special journal for writing when they are undergoing chemotherapy. And they just make notes of what's going on around them. They write down people's names. They ask questions. They prepare questions for their next medical appointment. Or they people watch and then take notes about the people that are around them. Writing about your emotional experiences can be really helpful when you're going through something like breast cancer and its treatment. Check out our video on journaling and the health benefits of keeping a journal during your breast cancer treatment. The other thing you can do is bring a craft. If you like to paint or color in adult coloring books, or there's something that you'd like to do, usually you can get a tray table so you'll have a surface on which you can do things. There may even be an art therapist where you're getting your treatment, and they can give you activities to do. Don't feel silly doing something that you did when you were a kid. You want to do something that doesn't take a lot of emotional energy, and you can just keep your hands really busy. You can bring your own knitting or crochet. These are some other things you can do. Whatever it is that helps you pass the time and really calm down your nervous system will be useful. There's nothing wrong that you can do during chemotherapy. Some people listen to music. You can watch movies on your phone, and a lot of treatment centers will actually have a television that has movies. Though I have to say, if you end up finishing your treatment before the movie is over, that can be annoying. So a lot of people do bring their own movies on a little DVD or Blu-ray player, or again, on your phone. Other things you can do is think about the future. You can make plans for what you'll do when you're all done with this. You can plan a trip. And though we don't want to encourage a lot of spending, impulsive spending, you can also do online shopping. You can plan for birthdays where you're responsible for buying the gifts, and you can find out some really cool websites other than the really big websites that we think about that maybe you don't want to keep shopping from. Other things you can do is practice meditating. You can download meditation apps, many of which are free, and learn how to just drop into your body and focus on your breathing. If you've always wanted to learn to meditate, this is a good time to consider doing that, and it can really help decrease the stress. I do want to make a point about meditation. Meditation is not about emptying the mind. It's actually not possible to empty the mind. What meditation is really good for is noticing the attention of your mind without judging it, focusing on your breathing and your body and being present in that moment. It's not about having a blank mind. Again, that's really hard to do. You can learn to strengthen your muscle of attention, But again, a non-judgmental stance towards what's going on in your mind can be really, really helpful. You can play a game. You can play games on your phone. You can bring a game from home, something small. You don't want to bring something really big because the table that you'll get will be pretty small, just because there are a lot of people getting treated, and your treatment team, your nurse and pharmacist need to be able to move around you. Lots of people nap during chemotherapy. Some of the medicine you get to help prevent side effects can make you drowsy, and there's absolutely nothing wrong with taking a nap. You just want to make sure, as we've talked about in terms of managing fatigue, don't nap for too much time because you don't want to mess up your sleep at night. You can always talk with other people in the treatment center unless they've asked for privacy, and you'll be able to tell that because there'll be a drape pulled. But a lot of my patients have actually formed pretty close relationships with other people getting treated at the same time. You can practice your listening skills and ask people about their experiences and listen non-judgmentally, and learn to do some reflective listening. We could always do a video on that if that's something you'd be interested. If so, drop us a comment. I think those are the main things. Bringing your own playlist is good, and your own things that you find you use when you're bored other places. Those things will be really useful here. The difference is, unlike waiting in the line for your driver's license, this can be a much longer period of time. And once the routine is established, you may find yourself getting bored. I do just want to say one thing. You may find that the books you read and the journal you write, the movies you watch may get associated with the treatment center and the whole treatment experience. And so be careful not to read your favorite book when you're getting treated. You may think that would be the right thing to do, but just like I recommend that people not eat their favorite foods when they're getting chemotherapy, unless they want to develop an aversion to it, you can really start to associate what you read, what you watched, who you were with, the games you played with chemotherapy. And it's not to say that we want to ignore everything that happened, but it's just a reminder that you're going to have those stories and those movies associated with your treatment. Again, not a bad thing necessarily, just something I've learned from my patients. I hope this has been helpful. If it has, click like and subscribe. Drop us a comment or a question below. Follow us on our new Instagram page. And as always, if you want to learn more about your treatment options, go to yerbba.com for your personalized report.